It's the health service row that's causing a lot of worry. At yesterday's government briefing, Health Secretary Matt Hancock claimed that 1 billion items of protective equipment had been distributed to NHS workers around the UK.
Well, however, despite his claims and promises to provide more, many frontline workers continue to feel let down by the lack of adequate protection that's available. One such person is home care provider Alice Ushamba, who says that there's not enough PPE for her and her staff to visit their vulnerable clients. Good morning to you, Alice.
Good morning, Alice.
Thank you for joining us. So Matt Hancock said yesterday 1 billion items of PPE were delivered to health staff. What have you seen?
Well, I'm not sure about health and social care. We haven't got any masks and we've been struggling. Prior to this, last week, the guidance for community care, domiciliary care, precisely, we were told to wear masks for clients who showed symptoms or confirmed cases, which was really difficult because no one showed symptoms. Well, some people would, but not a lot. And we didn't have any confirmed cases because no one was tested. So we didn't have any masks at that point. We did get the initial 300 masks going back a few weeks, but we've not had anything else. So Sunday night, I got an email to say you need masks for all care calls. And we have at least 220 care calls in a day. So we're using at least 1,000 masks. My first challenge was, where do I get 1,000 masks, in 24 hours? And we've not had anything. And all the suppliers, their prices have gone up. And I suppose it boils down to the manufacturers, their prices are going up.
Well, your prices, you're saying that the mask used to be £5 for a box of 100, and now those unscrupulous suppliers are now charging £60 a box for 100. That's how much the prices have gone up for you. So they're in this time of massive national crisis, you're being ripped off by them, which in itself is astonishing. Do you feel forgotten?
Yes, we do, because we don't have anyone to pass down that cost. Suppliers get, they've had this cost and they can pass it down to us. We don't have anybody. Most of our clients are predominantly social care and NHS, so we can't pass down that cost. But then at the same time, there's all this stuff going out everywhere, but we're not getting it. And what I want to say essentially is, if we're not protecting people in the community, we're not stopping the virus from spreading, because we see it first in the community. We see the symptoms first. If I go in as a carer, I could see 20 people today and I could spread it to 20 people. And if I don't have a mask, it doesn't help, because I'm not stopping people going into hospital. So prevention is better.
And what I was going to ask you is that you rely on your staff in order to keep going with this really important work, this lifeline that you offer to the community. But because this PPE hasn't been in place, a lot of your staff members have said that they don't want to come to work because they don't want to put themselves and their own families at risk.
Yeah, sadly, we don't have a lot of staff. People have just said, I don't want to put my life at risk. I don't want to do this. It's not worth it. And understandably, everyone has to put their family first. But as a provider, I've got a duty of care, moral duty of care and a legal duty of care. So I can't sort of say, oh, I'm going to do the same. But at the same time, I don't have that PPE. I don't have the answers. I don't have that mask. And we have the elderly people who are saying they don't want care as well because they're worried that carers don't have masks because they could spread it to them. Because it's not only us getting the virus, we could be giving it to the elderly clients as well. So, I had 30 staff. I'm down to 18 because some have resigned, some isolated, some just didn't turn up. And I know it sounds really bad, but I totally understand them. I can't blame them.
Have you lost people to the virus?
Yeah, we have.
And do you think those people's lives could have been saved if you'd had better equipment?
I don't know. It's not for me to say. I'm not sure. And I don't know. I don't know whether they got it from us, from family. I can't say. It's a very difficult one. And some were not confirmed cases because they passed away at home. So we can't say. We can only suspect, but we don't know for sure. We only know one case who passed away in hospital. She was confirmed a COVID case, but that was last week. So we could have been going in to see this person with no masks. So I don't know.
Alice, you can tell by just speaking to you that you are under an immense amount of pressure, and this is taking a real emotional toll on you. How are you coping? How are you sleeping? Because like you said, you've got a lot of people looking to you for those answers that you just can't give. How are you coping?
I'm not very well. I've had a lot of support from family and friends. I speak to people, but like I say, on Sunday, I sent a message to everyone in my contacts, even people that don't work in health and social care. And I said, you know what, I can get masks ready for tomorrow. I'm waking up at night and I think, what am I going to do tomorrow? What if we run out of masks? You know, but following, you know, I've had people get in touch and reach out and offer some masks, be it 300, 150, it makes a difference. So I feel a lot better after yesterday because I had a few people get in touch, people offering to help, people giving some ideas. Necessarily, that may not work, but it's the thought that counts sometimes. So, yeah.
Well, thank you. Thank you for talking to us.
Alice, thank you.
Alice, I hope you managed to fight your way through this. And the people who shouldn't be sleeping at night are the suppliers who are charging £60 for a box of 100, that's for sure. Hopefully, someone can get in touch with us and maybe we can put you in touch and get you the mask that you need. No guarantee on that, obviously, but we'll see what we can do. Thank you, Alice.
Thank you, Alice.
Thank you.
Lots of love.
We've got our very own doctor who's been on the front line herself. Dr Larisa Corder now joins us. Good morning, Larisa.
Morning,
you are on the front line. What's your experience of PPE availability?
I think we've all heard and are well aware there's national shortages. Thankfully, we have enough in our hospital, especially in our intensive care units where the risk of exposure it's at its greatest. But as we've heard very tellingly, there are some horrific stories coming out regarding other NHS units just not having enough. And what's more, even outside in the district communities and in social care. And it's so difficult to hear these stories, especially as a healthcare professional myself, to know that there are colleagues that we are losing every single day due to this virus, lives that we shouldn't be losing. It's one thing to not be able to control some of the effects of this virus and to be grappling with dealing with, you know, the serious consequences of treating this disease. But it's quite another where these deaths are actually entirely preventable and we are letting colleagues go. We've got over 100 healthcare workers who have now died, and one death is awful enough, let alone over 100. It's just completely unacceptable, and it makes me shudder because my heart just goes out to all of those people and all of those families, and knowing that I have colleagues across my hospital and also other NHS units who are pregnant and who have put themselves on that line in immense danger and are exposing themselves to this virus in order to save lives, and they're just not getting the protection that they need.
The figures, because we watch the briefings every afternoon, and you watch people sort of appearing to dodge the questions, really, because the stats that we've been given, and as I said yesterday, you want someone to say, no, that's not the case. Millions of boxes of PPE sat in British warehouses ready to be exported abroad, apparently. One firm in Nottingham, Printers Prime Group, transformed its operation, took on 30 extra staff, ready to make up to 1 million buys a month. That's 35,000 a day. It's already delivered 350,000 to frontline NHS and care staff for free or at cost. But the boss, John Tolley, revealed that they'd been unable to get a big NHS order after investing £250,000 on materials. It looks like, and we were watching Piers this morning on the telly, saying that maybe the military could be more involved here because it's just a question of logistics. This stuff seems to be around, but it's just, it's a massive task. We've never done anything like this before. It's just getting it to where it's needed.
It's a huge logistical operation. It's really difficult to meet, first of all, the supply needs at the moment, and that's in terms of the kits, so the PPE, but as well as drugs, drugs that we're using in intensive care, because all of our intensive care units are full and we're running out of things. So keeping up with that demand is a huge logistical operation. But as a result of that, because this is what I've been hearing too, and I'm well aware, having made inquiries myself, that there are shipments ready to go out. It's just a question of distributing it. So what I've decided decided to do is actually take some of this into my own hands, and try and make an effort, certainly at the local level where I can. So I have actually been in touch with the Duchess of York, who has agreed to help me with this. And together we are actually going to ensure we get these supplies into the country as soon as possible, and then distribute them to all the places that actually need them so desperately and where this help cannot get there in time.
Well, that's incredible, and good luck with that.
She's got in logistics. But,
I know, but if she can do it, amazing.
Every hand on the tiller helps, for sure.
You know what? Even if it means getting into a car, driving around with my friends, just distributing this stuff to the various hospitals, that's something I'm very willing to do.
Absolutely.
Larisa,
you do believe, on a slightly more positive note, that we could be past the peak of this, and that you are seeing admission rates in hospitals lowering?
Yes, certainly in ITU. I mean, it's still too early to say, but the number of admissions does seem to be reducing. We are seeing some bed availability now, and those beds are being filled, but it's mainly due to transfers between units. So that is a really positive thing. And also in terms of some of the personal stories and cases I've looked after, we really are beginning to see that turn of the tide, and patients turning corners and slowly and gradually getting better. So that is for sure. And we're trying to keep spirits up. We're now trying to connect them with their families. Just yesterday, actually, our head of family liaison was going around with an iPad and actually speaking to the families, and was going around showing them the patient who's in ITU, and who, of course, in some instances can't even hear them. But it's just so important for families to have that interaction and to understand what's going on and help these patients to heal. So there is positive news coming out of this, but it's very slow and it's very gradual, and we have to be very patient and not take our foot off the pedal at this point in time.
Thank you, Larisa. Thank you to you. Thank you to your team. Thank you to the teams up and down the country. Thank you very much. We'll be clapping tomorrow night for everybody.
Yes, we will.
Thank you. Thank you. That means a lot.